Video like this. So I'm going to show you guys the pump. I don't know if you can see my face or not, but I can't like switch the view while I'm doing that. So I'm going to turn my phone around so you can see the pump instead of my face. All right, here is the pump. So when you have the cassette here, this one does have some air in it because I just came down here from upstairs. So you're going to hold it with the little lollipop stick up like this, and the white thing here is pointed away from you. Hopefully this will all work with one hand here. And all right, here's the inside of the pump, and you need to get this in front of that silver thing there. When you put it in, it just kind of like, you can kind of see the track right there. This is actually better than doing it in real life. And you, if I can get it, place the little cassette in like that, then you close it. I should have turned it on, and now it's going to turn on, and hopefully it'll work with that little bubble in there. I just came down here. All right, so here's the pump. It's turning on. It's going to test the system. All right, and then training mode, I'm going to hit enter. All right, so what I'm going to do to get this to stop is I'm going to open it. I'm going to close it again. Maybe it'll work. All right, cassette test in progress. Good. So what happened was that it said there was an occlusion, and probably what it was that this green clamp, I had clamped it back from last week. That was clamped, and it cannot be clamped in order for it to go. All right, so for the pump, see if I can remember their numbers here. So we have, I hit pump A. That is going to be your primary pump, which is just our normal saline. The first thing you want to do is find your drug. You always want to find your drug first. So I'm hitting this button. It's hard to do with one hand because it moves. To hit 1, to hit the list. Then this right here, I'm too close. To select down, I'm going to hit IV solutions and hit enter again. All right, standard program, sweet. Now I'm going to go to the rate. And we had a math problem, and I believe it was 83 mLs per hour. The VTBI is volume to be infused. Now, since we have our bag, remember our bag when it's full, pretend this is full, was 250 mLs, but we needed that larger amount. So I kind of forget right now because I don't have the paper in front of me. I think it was 1,000. It was either 1,000 or 2,000. You all can see. So we're going to have to switch this bag. It doesn't matter right now. We're going to have to switch this bag in and out until we reach that number that is in the order. So what we don't want to do is put 250 in and let this run dry, meaning that like there's a bunch of air in the tube here. We want to use this tube again for the next bag. So I'm going to make it a little less than the amount that's in the bag. So maybe like 240, so that when I am, it will beep at 240, and then I can go in if I haven't done that already and get the next bag ready so that I don't have to worry about switching out the tube. I can just switch out the bag. Sound good? Wonderful. So it'll take about 2 hours and 53 minutes, and I hit start. It says this is how you can do a med check. You verify all of that, and then it'll go. I'm going to hit stop right now since it's not going into anything. But you could keep it running for your patient. It's just this, not for this because it's going onto the floor. So then I'm going to hit B. The B is going to be our piggyback. So here's our 100 ml piggyback here. I'm going to try to do this with one hand. This is where we are going to put the piggyback onto. So we need to scrub this port here really good. Then we have our tubing. Come on, baby. And we take that end cap off. Where's my camera? We took the end cap off. We don't want to touch that really with our glove. And we're going to place it down here, and you have to have that little ring thing around, and it twists to the right so that it is attached. You want to make sure that the tubing goes back behind. The newer sets, the newer pumps have like, you know, it's easier to not, if it goes like that, it'll tell you that it's clamped and that there's an occlusion. So you want to make sure it's back if you have these older pumps. And then also make sure that your roller clamp is on and ready. See, it's not dripping because it's in the pump. All right. So I already hit piggyback, so we're in there. So I connected it. We're going to hit drug list. We need to find Cipro, and these are in alphabetical order, but it's not on this page. So you need to go page down, and page down until I get to Cipro. And then I'm going to click it. I gotta get going. Come on. Come on, baby. Enter. Standard. All right. Remember it was 200, I believe, mLs per hour. Yep. Volume to be infused. This is my antibiotic. I want to infuse the whole thing. Pretend it's full. I don't want to short side them, so I'm going to put the whole 100 mLs. You can double check that because it's going to say 30 minutes. You're like, yep, that's right. That's my order. And I hit start. Double check. Yes. So then it's going to tell you that while this B line is going, the piggyback, your main line is going to stop. So yes, I know that. And it's going to go. And then you hit go. This one will go, and it'll switch back over to that one when it's done. All right, so that's that. And I have the piggyback, or the main line here is the one that goes down if you get any. I'm trying to stop it because it's going to the floor. Stop. Choose to stop. Stop all. Okay. So if you get a question, if you have like the piggyback set up here, the main line is the one that goes down further. The piggyback goes up. I know this is the wrong name for our scenario, but I had to find a bag real quick. Especially if you're using gravity tubing only to do this, you would hook them both into the same thing, and the one that is up higher will run first. I know it sounds weird, but it actually works. And then when that one's all done, this one would kick back on, just like the pump would do. You don't necessarily have to use this little hook here, but sometimes you might have more than one bag on a hook like this. So it's definitely going to be easier to see which bag is which and verify the medications and the name and all that kind of stuff if you do use that. So there's your pump. There it is. If there is air in this tube right here, you can do this thing called back prime, which you need to make sure that your secondary is clamped. You would go get a sterile end cap for your secondary. You would pull this off. Let me grab something. So scrub that with alcohol. You attach an empty, I had to shoot out the saline, an empty one of these right here. And then if there's air in here and it's telling you that, it's not going to let you go forward. You have to back prime unless you want to restart and do a whole new tube. So all you do is hit the back prime button. Watch. It will pull the liquid out of that thing and you can pull air out. And then it will retest it. And let's say there was air before, now there's not any air, and then you can move forward. Sometimes you might see, sometimes nurses, if they're having trouble with a certain thing, they leave it attached. If you see it up here like this, sitting like that, do not reuse that. You need to go and get a new sterile empty 10 ml syringe, or if you can't find an empty one, you get rid of the saline and then you hook it up onto there. So don't use one that's been sitting there. And you always need to get new. They have new caps. They aren't like this, but just remember, whenever you are unhooking an IV, you do not want to leave it like this dangling. You always go get the sterile end cap, and then when you're done, you take that end cap off, hook it back on, and then make sure that this is unclamped, and then you can restart your stuff. So there you go.